I think that generally the research would say there's two kinds of late starters for vaccination. One is those without health insurance who may not get in, and in particular the kids who are covered early, like right from birth by Medicaid, might get their early vaccines, but then start to trickle in terms of their completion rates after about age 2. So that population, we need to make sure that they have health coverage so that they can get their vaccines. The other group that sometimes delay or withhold vaccinations are the college-educated, very affluent folks who are reading the internet, who well-intended believe that they're doing their own research, but they do not always know the sources of the information. These are not always credible sources who are published in peer-reviewed journals. These folks are not PhDs in virology. They do not study vaccines and their effect on children and on adults. So that group are very concerned about their kids and can become quite fearful and may not vaccinate or may withhold until the kids are older. The trouble with withholding vaccines until your child's over 2 or over 3 is that many of our diseases, such as diphtheria, Haemophilus influenza, and others, are devastating in kids under 2. That's when they cause deafness, blindness, mental retardation, inability to walk, and death. If parents do a regular checkup for their child from birth through the teen years, and again, in those over age 5 years, it's once a year, then they'll be able to get their vaccines regularly, and that's important visit to keep. So whether it's your child's birthday or just before school every year, make sure you get that nice well-child checkup every single year, and make sure that you check that you have your vaccines. In fact, I would encourage parents to ask their provider if those vaccines are entered in Florida Shots in our state registry, because parents can be the advocate to make sure that the records are kept for their child long term and can be given from one provider to another. The other piece in terms of how can providers help parents keep vaccine appointments, one, I think providers need to advocate with the state so that parents can see the shots records, that our state registry should be open not for parent entry but for parent viewing, so they can see when their kids are due for the next vaccines as well. There's also some research to suggest there are helpful ways to remind parents, such as using new mobile technologies. Texting from a doctor's office to a parent to remind them that either a vaccine is due or that their appointment is in the next 48 hours is an effective means of increasing show rates or decreasing no-show rates so that parents get into the appointment. I still have my smallpox mark on my arm, but most parents these days don't. They didn't get vaccinated. It seems like something in the dusty annals of history. But we sometimes think that there are other diseases in the dusty annals of history, and they are not. For example, polio. We have the luxury in this country of really not having new cases arise in our country of polio. But in many parts of the world, that's still reality, and so children are still dealing with the effects of polio, which include paralysis, trouble breathing, kids who are walking around on limbs that are using assistance to get around because their limbs aren't working correctly. And so I think we need to be mindful that these diseases are not all eradicated, that the childhood immunizations are very important for our children here. Particularly in a place like Florida, where we get new immigrants all the time, as well as families who travel elsewhere. But I think that even closer to home, there are illnesses that were quite rampant and quite dangerous until very recently. For example, Haemophilus influenza, which is a disease that we prevent with vaccination in the very first months of life, is something that caused meningitis, caused death, and was the leading contributor to disability, mental retardation that was acquired after birth in our country. So that's something that many countries still south of our border grapple with and don't vaccinate for regularly. Nowadays, if that child has not been vaccinated, right? So the scenario works for children who have been vaccinated. But if the child hasn't been vaccinated because a parent decided not to do that, then we do have to worry, as they have to worry. So a fever in a kid who hasn't been vaccinated is not most likely, it may even still be most likely a virus, but it could also be something that is quite deadly that can harm that kid very quickly in a matter of hours to days, and we need to do all of this testing. The vaccines we give early, we give because children are vulnerable early, and so we're giving them to children in the first few months. I know a lot of parents don't like them. We don't like to make kids cry in the first couple months, but the reason that it's so important to start those vaccines early is because those diseases disproportionately affect young children. And so those diseases are ones that in young children can be devastating. Pertussis is a nice example. So pertussis in an adult, in me, I had it when I was in my 20s, can give you a bad cough. People know it as the whooping cough, or in adults it's the 100-day cough. So I was in the emergency room and with a mask on for 100 days, 3 months, and couldn't complete a sentence. But one can live through that. For younger children, pertussis is a deadly disease. They literally cannot breathe. They turn blue, and despite all that we do with medications, with ventilators, etc., we very often lose them. I lost one of those children when I was a resident. The pertussis that baby got was brought home from his father. And it's a horrible, horrible thing to go through. But had that child been vaccinated in his first couple of months, he might have been saved. The other part of it is we give vaccines to children young because children even younger may be at risk. So the children who are too young yet to receive a vaccine benefit from the kids they're around, whether that's in childcare or in their own home or wherever that might be. We give vaccines early so that we can prevent disease in a population. There are other vaccines that we give relatively early. For example, influenza. We give to children as young as 6 months of age. And when we do that, we protect those children. We protect all children they're in contact with. We protect their teachers, etc. We protect their grandparents who have weakened immune systems themselves. And our epidemiologic studies have shown that infection, particularly influenza, in younger kids is passed on to the older ones, who not only have a high chance of getting influenza, but have a very high chance of getting very sick, developing pneumonias, having to be hospitalized, or even to die from that. Sometimes we vaccinate children when they're young for other diseases where they might come into contact with people who are more susceptible. For example, the MMR vaccine, that rubella, the R in MMR stands for rubella. Rubella in a child is not a horrible disease, but rubella in someone who is pregnant is an absolutely horrendous disease. Rubella in someone who's pregnant will either cause a miscarriage or cause something called congenital rubella syndrome in that child, where they are born deaf, they are born blind, they have multiple congenital anomalies, including mental retardation. It's not right that women who maybe not even know that they're pregnant yet can contract rubella from somebody who's unvaccinated, because this is a woman who's works in a child care center, or maybe who babysits your child. We vaccinate children early for their own sake. We vaccinate children early for the population's sake. We often speak about childhood vaccines, and we think of that as what one needs to go into school. Certainly there are multiple vaccines that we need even before school, so things that can make kids so sick that they die, and used to die in huge numbers before they turn 5. Those childhood vaccines are very important to start as early as we possibly can. At the same time, some of those vaccines will protect children into their teenage years, their adulthood years, and beyond. One great example is hepatitis B. We give hepatitis B to young children because we can, because it's safe to give to young children, because we don't want them to contract hepatitis B, and a lot of them did, even as very young children, from mothers and from other adults around them. Hepatitis B infects your liver. It's a bad disease. People turn yellow, they can have chronic hepatitis, their livers don't work, which means you have trouble with clotting your blood, cleaning your blood, other sorts of things. Hepatitis B also leads to liver cancer. We don't tend to see, and never really saw, huge numbers of children, youngest children, having hepatitis B, but it prevents that hepatitis B-caused cancer in adulthood. So sometimes we don't realize that the childhood vaccines are protecting us far later. Another example is the human papilloma virus vaccine prevents the transmission of human papilloma virus. Great. But the human papilloma virus is the incident factor for cervical cancer. Cervical cancer causes 10,000 deaths in the United States. It doesn't cause these deaths in children, it causes it in adult women. And it tends to cause it some 10 to 20 years after someone gets infected with the virus. So you get infected with the virus, your cancer comes when you're now a young mother. The effects of vaccines then are generational. We can prevent the transmission of a virus in the child or the teenager. We can prevent that child or teenager from contracting the virus. We can then prevent cancer in the adult woman who now is raising children of her own, so that we can prevent those children from becoming orphans, from losing their mother. That's a very powerful reason to vaccinate, and to vaccinate early. There are other vaccines that we repeat. For example, influenza. Influenza vaccine is a good vaccine to get every single year because we know that the influenza virus changes from year to year. So we need to vaccinate against that every single year. That's one that prevents virus transmission in all people, all ages, but it particularly affects the elderly, folks with cancer, folks with weakened immune systems from contracting influenza, which in them is more than a nasty cold. In them, it causes hospitalization, pneumonias, septic bacteria running through your blood, and death. We as parents, basically, we have to get our children ready for their lives and their future, for them to be happy, to be healthy, to contribute to society. Vaccines are part of that. And if it means giving them early, so before they have their risk, when we give hepatitis B vaccine, we are not, and even when the blood supply was infected, we were not thinking our child had any risk of soon getting a blood transfusion. But some of them would. Some of them will be in car accidents despite our very best intentions and buckling them up appropriately. They'll be in car accidents, they'll have other reasons why they may need a blood transfusion. So we protect in advance. Why wouldn't we want to protect our children and our future grandchildren from a mother or a father contracting cancer that they didn't see coming? Why not prevent 10,000 cancers in this country alone every single year, and the heartache that comes with that? So the reason to give HPV vaccine before someone starts their sexual life is because you want them protected before that sexual life starts. It's very hard. I'm a parent of a young, almost teen in this age range, and I understand completely how we don't want to conceive of our little girls or our young boys as future sexualized beings, but it actually happens to all of us. They will have a sexual life at some point. The issue is to give the vaccine before that starts. And this vaccine is actually a series of 3 vaccines, which could be given in as quick a period as 6 months if we want to go back to see the doctor 3 times in those 6 months, but might be spread out over a couple of years more realistically for a lot of kids. So if it's going to be spread out over years, you don't want to start it too late. The truth is, HPV is such a common virus. It's in some 60 or 70% of the population. As it is, we don't always realize we have it. And so there aren't signs of this for most of the population. People look healthy. We as adults may not even know we have it. It may not make us sick. Sometimes the sickness comes the 10 or 20 years later with HPV caused cancer. So The reason is simple: give it to them early. Now, it's kind of funny, actually, that we get hung up on the HPV vaccine because it's transmitted, the virus is transmitted sexually, and we're protecting a cancer later. We have another vaccine like that. The hepatitis B vaccine is against hepatitis B, which again is a virus that used to be transmitted in blood, but we have ways to clean our blood supply now, and is very often transmitted through sexual activity. And we give this to our babies. Yes, babies can get HBV, or hepatitis B virus, and they can get hepatitis from that, but we're preventing the cancer that's caused later. Adolescent vaccine rates lag behind early childhood vaccine rates for at least two good reasons. One is too few of our teenagers have health insurance. And so among children, teens are the group, age-wise, that have the least amount of health coverage. We need to change that, and that is a responsibility of all health professionals. We have systems in this state to help those teenagers get care through Kid Care, and people can sign up and get that. Teenagers should get coverage. Another reason, perhaps related, but parents don't get as nervous when a teenager has a rash or a sore throat. They don't run to the doctor as quickly, so the teenagers don't see their doctors as often. It's very common that a child I'm taking care of, a teen, will come in with a sore knee or a sore ankle, and that teenager will, I say, well, when did it start? 3 weeks ago. And the parent will say, I didn't know until yesterday. Because teenagers themselves don't complain and they don't want to come and see the doctor. But probably the biggest reason that vaccine rates are not complete in teenagers is that parents don't know that they need vaccines. So many of them were carrying around their little yellow card, and thank goodness we now have Florida shots to help augment that. They carried those little yellow cards around for the first 5, maybe the first 10 years, and then thought, I don't need these anymore. They knew that the child needed vaccines to go to school, but they didn't know about anything after the age of about 5 or 6. And the truth is, our science, of course, is always evolving and improving, and we have newer vaccines to help the teenagers and to help teenagers from spreading disease to other people. So the real important thing is teenagers still need checkups every year with their doctor, and they still do need vaccines. So they need those vaccines to protect them against some diseases that pass through the entire lifespan, the entire population, updates on things like influenza and tetanus and pertussis. But they also need vaccines that particularly affect them. Meningitis is a disease that we see higher incidence of meningitis and death from meningitis in teenagers, partly because of their age and partly because they tend to do things like go to camp or go to college, where they're living in more crowded living situations and these diseases pass more quickly. It's incredibly important that those vaccine updates start at age 11, but then continue. If you do all your age 11 and 12 vaccines, you're still going to need some more at 15, and you're still going to need some more at 19 to 21. Well, we teach vaccinated every opportunity. That is because a lot of our teenagers do not come in for regular checkups. If they don't, they need those regular checkups. I could speak for hours on why teenagers in particular are a group that needs to see their doctor on a regular basis. But if someone comes in with a sports injury or a acne visit or something like this, that may be the only opportunity a physician has with those children, with those teenagers. I often talk to the residents, the doctors in training, about how when you see a teenager, do a complete workup, including assess their vaccination, because it may have been 2, 3, 5 years since they saw a doctor. It may be another 5 since they see till they see a doctor again. They tend to think of themselves as quite healthy. They often are. Teenagers, characteristically, by normal cognitive development, also think of themselves as immune to any kind of disease or infection or anything like that. It's very important to check their vaccines because we know that we have teen vaccines. When parents say to me, if I ask, what vaccines has your child had lately? They say, oh, they're up to date. When was the last one? I think he was 5 before he went off to school. They don't always carry their vaccine information with them. And we know that we have vaccines that are appropriate for teenagers. Well, there are a couple reasons. Number one, I'm somebody, particularly with my own children's health as well as my patients' health, that I'd like to do a double check on everything. So I'm not going to rely on just the schools. As wonderful as our school folk are and our school register are, I'm not going to rely on just the schools to tell me that my child's vaccines are up to date. I want to go ahead and make sure that my doctor's in agreement with that. The second reason is because school requirements for vaccines are set by the legislature. And we know that laws often lag behind recommendations in terms of best health practices. So there are vaccines that are intended for children and will keep them safe that aren't required for the schools. Among those are influenza, meningitis, which is a teen vaccine, hepatitis A is a recommendation, and HPV, or human papillomavirus. In Florida, our rate is in the low 90s in terms of overall vaccination, and that's really good under one lens. On another, we don't have to be perfectionists to realize that we want that higher, and we want it higher because the more kids that are vaccinated, the less infectious disease will be passed on to other people, including younger children who can't be vaccinated yet because they were too young to receive the vaccine. So we do want to boost those numbers up to the 98, 99, 100%. We also have to recognize that not every child who gets a vaccine is immediately protected. So your immune function, the reason we give 3 or 5 boosters depending on the vaccine is because to get your immune function up, you need to get that many numbers of vaccines. And some people still, since we all react a little bit different to medicines, some people still won't have a response. How do we protect them? We protect them with herd immunity, meaning that if everybody else who sits in the classroom also got a vaccine, the chances are no one's going to be passing that disease onto that child who maybe didn't mount an immune response. But even when we look at overall vaccination rates, which may be quite good, we have to realize that that's an average across a state or across a country. And so there's still going to be pockets where it's much lower. And we've seen this with outbreaks of measles and pertussis and other diseases, Haemophilus influenza, that killed children up in Minnesota. So when there are pockets of folks that decide, I'm not going to vaccinate my child, or I'm going to, if not withhold, delay vaccination until they're a certain age, that means there's a longer period of time and more people that can pass this infection, both to the unvaccinated population and to the partially vaccinated or the little children who are too young to receive the vaccine and for no fault of their own are now going to be vulnerable to this disease. Nowadays, we also have to think about the benefits to adults and to older people, because actually many of us who are living with chronic diseases are able to do so because the children are also not passing those infections on to older people with cancer on steroids, etc. The thing about infection is it cuts across all lines of socioeconomic. It doesn't matter if you have a higher education or you're in whatever strata economically, but contagion is contagion. To some extent, of course, people who are living in more crowded areas, who are don't have clean water, et cetera, the contagion is going to spread more rapidly. But our ability to focus on the diseases that we do now, my ability to work in injury prevention, is in many ways a luxury because vaccines have helped us cut the legs off from these viruses and bacteria that were killing children in such high numbers.